The primary areas that we're going to look at are privacy and security, which is really what everybody thinks of when they think of HIPAA, as well as breach of privacy and security, breach notifications that you're responsible for, and then the things that really make us understand why we really need to know this, the actual enforcement penalties that come along if you violate HIPAA or if you allow somebody else to violate it for you. First off, the objectives of HIPAA. HIPAA is the Health Insurance Portability and Accountability Act of 1996, so it's been around for a while now. It has 4 primary objectives. We're not going to talk about all of these today in any depth, but I will at least go over them with you. They assure health insurance portability, which means that protected health information can go between different providers if it needs to, or between a provider and the person, that type of stuff, safely. Reduce healthcare fraud and abuse, enforce standards for this health information so that it all comes out in one, fairly uniform package, and that it has standards for how you protect it. And that gets into our guaranteeing the security and the privacy of your health information. That's the key that we're really going to talk about here today. As I understand it, everybody has access to the MidSouth HIPAA privacy manual. That will speak to just the privacy areas. It's much more in depth than I'm going to go into today. What I will do is I go through these slides. There will be several references to it. If you have any questions beyond what I talk about, you can ask me at the end, or if it's something specific, you can always go to the manual, to the provisions that I reference in here. That'll help you out too as you go through work. Who must comply with HIPAA? HIPAA applies to covered entities and business associates. Covered entities are health plans, healthcare clearinghouses, and healthcare providers who conduct certain financial and administrative transactions electronically. That would be you. MidSouth is a healthcare provider, therefore they are covered under HIPAA. They have to abide by its requirements. Business associates of covered entities. What is a business associate? That'll be defined in your privacy manual, section A. I'll go over it real quick. They are any person or entity that performs certain functions or activities that involve the use or disclosure of protected health information on behalf of or provide services to a covered entity. The functions and activities that are included in that are things like claims processing or administration, data analysis, utilization review, quality assurance, billing, benefits management. The services that can be provided are legal, actuarial, consulting, data aggregation, accounting, management, accreditation, and financial services. I am a business associate from MidSouth as a lawyer. Julie is as well. We fill that role for them. Other examples of BAs are utilization review consultants, accountants, things like that. The history of HIPAA, like I said, has been around a while. It was actually enacted in 1996. The privacy rule was brought into effect in 2003. The security rule in 2005. And then the High-Tech Act was in 2009. High-Tech came about as part of President Obama's initial economic stimulus package back when he first got into office. It was the American Recovery and Reinvestment Act of 2009. What that did was it promoted the adoption and meaningful use of health information technology. I'm sure everybody's heard about meaningful use and all that kind of good stuff. We're not going to talk about that today, but that's part of what that was. What this did for HIPAA was it established the breach notification rules that we are now under, and it strengthened the civil and criminal enforcement of any privacy and security rule breaches. After that, as a result of high-tech, we got the breach notification interim rule in 2009, the enforcement interim rule in 2009, then the high-tech proposed rule in 2010. They finalized that now in 2003 with the omnibus final rule. As a result of that, HIPAA now has teeth. It is in effect. It has all the good enforcement stuff. All the penalties are now in place. So everybody is now required to meet all this stuff. The compliance date for covered entities and BAs was back in September of 13, so we're now all on the hook. Key provisions of that omnibus final rule, some of these are going to be found in your privacy manual. I'll just put in references here so you can go look at them if you want to for more in depth. What it is, it now applies the same rules to BAs that are for covered entities. It further limits the use and disclosure of PHI for marketing and fundraising purposes and the sale of PHI without individual authorizations. It expands the patient's right to receive electronic copies of their health information. Excuse me. And it also allows them to restrict any disclosures to health plans regarding treatment for which they have already paid for out of pocket. Covered entities are now required to modify and redistribute their notice of privacy practices to reflect these new changes in the rule. And they have now modified individual authorizations and other requirements to enable access to decedents' PHI by family members and others. I'm not going to go into that really in depth today either. That's in Section O of the Privacy Manual. You are now allowed, when someone has died, you are now allowed to give out their protected health information to family members, friends of the decedent. However, what you're allowed to do is you may give it out to the extent they were actually involved with the patient's care beforehand. So for instance, if someone, all they did was just pay the bills, you may allow them to, you may disclose billing information to them, but not necessarily any actual health information beyond that. Also, any kind of disclosure like this must be in accordance with any wishes that you knew of that the patient had. Say, for instance, if they didn't want Cousin Sally to get any of their information, you can't give it to Cousin Sally. Why do you need to know about HIPAA? Again, now that we have the final rule in place that it finally has teeth, the enforcement penalties are now in effect. There are civil and criminal penalties for providers and for individuals. And OCR, the Office for Civil Rights of Health and Human Services, are now performing audits. They're going to come check companies, CEs, and BAs to make sure that they are in compliance. And we'll go right in now to the OCR audit program to give you a little example of what that is. There's a process set forth for how they do it. What you'll do is there will be notification. If an entity is chosen for an audit, they will be granted notification and a request for documents. Once they provide those, there will then be an on-site review, and after the on-site review, they will receive an audit report. The scope of the reviews, they cover the privacy rule, the security rule, and the breach notification rule. We're going to talk about all three of those a little bit more in depth as we go along. There is a copy on the OCR's website of what the audit protocol is. Anybody wants to look at that, feel free. I'm not going to bore you with it this morning. The program actually had two phases. There was a pilot program phase that started in 2011 and 2012. They audited 115 covered entities, no business associates at that time, just the CEs. 59 of those 115, so roughly half, were providers. The other 56 or so, whatever they were either clearinghouses or health plans. What they found of this, only 11% of the entities that they reviewed were issue-free. So almost 90% had at least something wrong with either privacy or security or breach notification. As a matter of fact, none of those that were issue-free were providers. Every provider they reviewed had something wrong. 58 of the 59 that were audited had at least one finding of security standard violations. Luckily for those folks, there were no enforcement penalties or other adverse consequences as a result. The pilot program was strictly educational at that point. They were just going out to look and see what they could find, see how everybody looked, and give them ideas of what they were looking for and ways to improve without actually penalizing them at that time. The findings at that point, 60% of the findings were violations of the security rule. That was the big one. As we go on, we'll sort of see security is everybody's going to think that's more of an IT issue. That's things like firewalls, computer safety, stuff like that. But it does also apply to employees as well. There are certain parts of that security that you are responsible for as an employee, whether you're involved in IT or not. Privacy rule was 30% of the findings, and the final 10% was breach notification. They have now moved it into phase 2, which is no longer educational. These are the permanent audits. They're going to be doing these going forward. They were scheduled to begin originally at the end of 2014. They moved them back to early 15. They moved them back again to late 15. I have not seen any results of any of this yet, but as I understand, they are actually being conducted at this time. They will serve as an enforcement tool. You are going to see penalties for these now. And again, I have not seen any numbers, so I don't know if they actually followed through on what their plan initially was, but the way it was scheduled was they were going to audit 350 covered entities and 50 business associates. What they're going to do is they're going to send notices out to the CEs, and as part of their documentation production, they were also going to have to produce a list of every BA that they had a contract with. And then they were going to pull their 50 BAs from those lists. They were going to check 100 of the covered entities on the privacy rule. 150 on the security rule, and 100 on the breach notification. So there's a possibility if you get an audit, you could get lucky that the stuff you're bad in is not what they're looking at. I would not count on that, however. The BA focus will be strictly on the breach notification rules, and then risk analysis and risk management, which falls under the security stuff. They're a very specific subset of the security that we'll talk about. They did list, or the OCR did give an idea of what some of their audit target areas might be. Under security, they're looking at things like device encryption, media controls, data transmission security protocols, physical facility access controls, and complaint processes. I would imagine that a lot of those words, when put together in those orders, don't mean much to you. We're going to go over those later so that you get an idea of what that actually means, because it doesn't really make much sense to me until I refresh my memory and look at it. Privacy, they're looking at safeguards and staff training. That's a big key. We're going to look at some of that later. I'll give you some examples of things where you have to make sure that everybody knows that. That's why you're here today. And then breach reporting, in other words, how you report any breaches that you have to the OCR, what your policies are for that, what your processes are, things like that. So what do you need to know about HIPAA? Today, hopefully what you're going to get an idea of are the broad strokes beyond privacy, security, breach notification, and enforcement penalties. Privacy is all throughout your privacy manual, so I didn't give you a specific section to go to there. Security is something different. We're going to try and go through most of that today. Breach notifications in Section T, enforcement penalties are Section G. I told you I was going to give you some football analogies. I'm going to see if this works now. Basically, what we're talking about with HIPAA is it's all about the protection of your protected health information. Basically, if you think in terms of a football team, you are the team. Your protected health information is your playbook. You don't want other people to get your plays. You don't want everybody to know what you're going to run, that type stuff. So you have to keep that private. You want to keep your playbook private from everybody else. Well, how you do that is through your security measures. Think about a football team again. These are things like getting into the huddle, where you huddle up before you call your offensive play so the other team doesn't hear what you're calling. You got coaches on the sidelines flashing up big cards and running signals and doing all this and all that to try and hide what they're calling out. Those are security safeguards that they take so the other side doesn't know what plays they're running. Same thing with you. With HIPAA, with protected health information, you have things like firewalls. You have things like keeping your doors locked, keeping files locked up, things like that. Those are your security standards. Breach notification. I would assume, since we're all in Mississippi and we're close to Saints country, nobody here is going to get offended if I make fun of the Patriots. Breach notification. Think about Spygate, if anybody remembers that, from 2007. The New England Patriots got caught videotaping defensive signals of the New York Jets across the sideline when they shouldn't have been doing that. They got busted by the NFL. That was the breach. The enforcement penalties are what they had to pay for that. Their coach got fined $500,000. The team got fined $250,000 and lost a draft pick. You're going to see similar enforcements for similar penalties for HIPAA. They're going to be in those numbers and bigger, actually. So that's why we really worry about this. Breach violations, things like that, are going to cost your company a lot of money. And if you're the one who does it, it can cost you personally as well, too. So those are the kind of things we're going to look at today. Starting with the privacy rule. That's in, if you want to look at this, the federal regulation, there it is. It's 164.500 and all its following regulations. I'm not going to bore you with a whole lot of those, but they're there. Also, again, you have your privacy manual you can look up. All this stuff will be in there. First thing I want to give you is an example. Loose lips sink ships. This is the whole point of privacy. You want to keep it inside, keep it internal, keep your stuff to who it needs to be kept with. Don't give it out willy-nilly. Back in June of 2013, under a settlement with HHS, Shasta Regional Medical Center settled potential, read that, potential violations, not necessarily that they actually happened, but they were potential, violations of the privacy and security rules for $275,000. The OCR, which is the Office for Civil Rights again, opened a compliance review of the hospital following an LA Times article which indicated that 2 of their senior leaders had met with media to discuss medical services provided to a patient. The investigation showed that SRMC failed to safeguard the patient's PHI from impermissible disclosure by intentionally disclosing that PHI to multiple media outlets on at least 3 separate occasions without a valid written authorization. Again, if you get it authorized, you can do it. There are certain examples of things that are required to be disclosed, certain other ways that you may be permitted to disclose, but for the most part, any PHI is going to, unless you're giving it out to the person themselves, is going to require an authorization. They didn't get those in this case. They blabbed it to the media and they got in trouble for it. The review also indicated that senior management impermissibly shared details about the patient's medical condition, diagnosis, and treatment in an all workforce email, sent it out to everybody. We're going to talk about that a little bit too, that not everybody in your company is entitled to or needs to see every piece of information you have on everybody. Different people have different job responsibilities, so they may or may not be allowed into certain PHI. In addition, Shasta also failed to sanction its workforce members for impermissibly disclosing the records pursuant to its own internal sanctions policy. We're going to bring that back up again a little bit later too. You have to have all these policies in place. You have to have set processes that you follow in cases of any breaches or in order to protect all your stuff. But having the policy is not enough. You have to actually enforce it as well. And you have to enforce it equally every time for every person. Doesn't matter if they're a janitor, doesn't matter if they're the CEO. If they violate HIPAA, they have to be punished the same way, and they have to be punished every time. General intentions of the privacy rule. Basically, your general rule is this. A covered entity may not use or disclose PHI unless they are required or permitted by the HIPAA privacy rules. An effective, again, the privacy rule has been around since 2003. None of this should be really new. You should have an idea of how this works. But what it does is it protects individuals' PHI, protected health information. Again, this is your playbook. You're protecting this from anybody else getting it. It gives patients more control over their health information and sets boundaries on how you may use and release their medical records. It establishes safeguards to protect the privacy of health information, and it imposes penalties if privacy rights are violated. That can be civil and criminal penalties now as well. So what is PHI? Again, what is your playbook? What makes it up? It is any information, whether oral or recorded in any form or medium, that relates to the past, present, or future physical or mental health or condition of an individual. So that's basically anything that's in the chart, anything in a patient chart, such as progress notes, diagnoses, anything like that, that's going to fall under that. Any information about the provision of health care to an individual. So that brings in correspondence. If you write a letter out saying that we saw you on this date or anything like that, that's PHI. That has to be protected as well. And any information about the past, present, or future payment for the provision of health care to an individual. So any bills, any billing information is also PHI. That has to be protected. There are 2 required uses and disclosures. These things, if these come up, you have to give information out for this. When the individual themselves, or in the case of someone who can't speak for themselves, their personal representative, specifically requests either access to their PHI or an accounting of the disclosures that you have made of their PHI. You are allowed or you're permitted to make certain disclosures to other people, like if you have another doctor you're communicating with about what kind of services you're giving, you can communicate with them, with billing companies, things like that. Those are disclosures you can make. You have to account for all those though. So that way if a patient asks you for an accounting of the disclosures that you've made, you have to give that to them. The other required use is when the Department of Health and Human Services is undertaking a compliance investigation, review, or enforcement action. Basically, if the big boss, the HHS, asks you for them, you have to give it. We're going to see a case later where somebody didn't and they got popped for it pretty hard. Basically, just don't mess with the HHS. There are several permitted uses and disclosures. I'm not going to go into a whole lot of detail on many of these. These are all going to be in the privacy manual if you want to look at specific cases. Basically, in your day-to-day operations of doing your job, if somebody asks if they can get a copy of something, if you don't know the answer, you can always go to this and look, or ask your privacy officer. They'll know. Certain permitted uses are to the individual at any time, whether it's, if they don't ask for a accounting of disclosures or ask for access, you can still give it to them. It's still permitted. It is their information after all. For treatment, payment, and healthcare operations, those things are defined in the privacy manual. Basically, again, like treatment would be where you're talking with another physician or another company or something who's also providing care, you can do it, you can talk with them. Payment issues, again, with billing companies, you can disclose. Healthcare operations are for the operations of your company, things like quality assurance, utilization review, stuff like that. Uses and disclosures with the opportunity for the patient to agree or object beforehand. Some examples of that are things like in nursing homes, they do like a facility, I've lost the word all of a sudden, facility roster, things like that, where they can agree to be put in that or not. Public interest and benefit activities, we'll have those listed here in another couple of slides. Incidental uses and disclosures, these are things like in the hospital, you see them walking around and you have the big whiteboard where it shows what patient's in what room. HHS deems things like that are necessary for the proper operation of healthcare, but they're not things that are really intentional disclosures of information. They're incidental. This also includes things like where if a doctor is in a hallway talking to a patient or a patient's family about their care, that's incidental. People can overhear that aren't supposed to, but at the same time, it's not an intentional use or disclosure. The thing is, with things like incidental uses, these things you have to use certain safeguards. This can be things such as erasing the board. This can be things like speaking in a whisper when you're talking about patients or not using names, things like that. And then limited data sets for purposes of research, public health, and healthcare operations. Healthcare operations, activities of that include quality assessment improvement, accreditation, medical review, legal auditing, all that kind of stuff. This is all in section R if you want to look at that. I'm not going to talk about that too long. It just gives you an idea of what those include. These are your public interest and benefit activities. The privacy rule gives you 12 of them. These are things that are required by law, public health activities. You may disclose information if you have belief that a victim is being, or that a patient is a victim of abuse or neglect or domestic violence. Health oversight activities in response to judicial and administrative proceedings. All of these things that are on this slide have their own certain sets of other requirements or prerequisites along with them. For instance, the judicial and administrative proceedings, just because somebody tells you that there's been a lawsuit filed doesn't mean you have to give up information. And as a matter of fact, you can't really do that. You have to wait for either a court order or an order from the administrative tribunal, wherever the case may be. But once you get that order, then you do have to give it. Research decedents, serious threat to health or safety. You may give information out to someone that you reasonably believe may be able to prevent that threat or alleviate the threat. You can't just give it out to anybody. These things are all listed in section D. If you want a little further information on those, that's in there. And then other than that, if it's not required and it's not one of those that we've listed, everything else requires an authorization. Covered entity must obtain the individual's written authorization, has to be written, for any use that is not for treatment, payment, or healthcare operations or otherwise required or permitted by the rule. These disclosures always require an authorization no matter what, psychotherapy notes, anything for marketing, anything involving the sale of PHI. Again, all this is in section D of the privacy manual. I'm not going to go much into marketing or sale. Those are explained very well in there. I don't know that that's really going to be something y'all need to worry about too much. But you can certainly look at that if you want to get an idea. Those are things like where people come in with, pens and whatever that have a company or a product's name on it, stuff like that. Sometimes it's marketing where they ask for PHI in order to know who to give that to, stuff like that. These are the core elements of a valid authorization. Just because you're getting a written authorization, it also has to have all of this stuff in it. Description of the information, the name of the person authorized to make the requested use or disclosure, the name of the person to whom you're going to make the use or disclosure, description of the purpose, an expiration date. That does not have to be necessarily a date. It can be an event such as the end of my treatment or the end of my lawsuit or the end of whatever. The signature and the date that it was signed, and there are certain specific notice statements. Those are in the next slide. The required statements for the notice must be adequate to let the individual know that they have the right to revoke the authorization in writing at any time. Whether or not the covered entity can condition treatment, payment, enrollment, or eligibility of benefits on them giving the authorization. The answer to that is no, they cannot. And the potential for the data that is disclosed pursuant to the authorization to be subject to redisclosure by the recipient. They have to know that all that can happen. You have to have that in the written authorization before they sign it. There's also a way of de-identifying health information that takes a lot of this out of play. If a statistician would tell you that the generally accepted statistical and scientific principles and methods for rendering it not individually identifiable determines it, or if it meets a safe harbor. The safe harbor is in the next one. Basically, if you're going to de-identify health information, you have to take out all of this stuff. Names, geographic subdivisions smaller than a state, so any city or county would have to be taken out. First 3 digits of a zip, any dates, and that's every part of it, month, day, year, all that. Any telephone, fax numbers, emails, social security number, medical record number, health plan beneficiary account number, basically everything in there that has any possible way of identifying who this person was, where they were getting treatment, what kind of treatment they were getting. Any of these identifiers have to be taken out completely in order for it to be de-identified. Once it is, you're free to give it out to whoever because there's no way to tell whose it is, but you have to make sure every single one of these is checked off before you do that. Patients have the right to access and amend and have an accounting of their personal health information. They can access it, they can seek to amend it, and they can have, like we saw earlier, an accounting of any uses and disclosures that you make of it. The uses and disclosures in Section B, if you want to look at that. The other two are pretty self-explanatory. Patient has rights under the privacy rule to all this stuff. They have a right to get the company's notice of privacy practices. They can request restrictions on the use or disclosure for who you send it to. You don't necessarily have to follow any restriction they make, but you have to give a reason why not. They have the right to request communications by alternative means or alternative locations. It means they can get it electronically, they can get it in handwritten hard copy form, that type of stuff. Have the right to access, request amendment, and obtain an accounting. Individual access. If they ask for access, you generally have to give it within 30 days. You may obtain one 30-day extension. You have to give them written reason why, tell them why, and then you have to get it within that second 30. If it is maintained in electronic form and they request it in an electronic copy, you may provide the access to them in the format requested if it is readily producible. If it is not, you may give them an explanation why not and give it to them in a separate form. But you have to agree to what other form it is. They have to agree to how you're going to do it. If they request it to be sent to another person instead of themselves, you must comply, but that request must be in writing, signed, and clearly identify who it is they're sending it to. And the company may, of course, always charge a reasonable cost-based fee, including labor and supplies, for any portable media that you send out. So if you give it to them on a jump drive or a disc or hard copies or whatever that costs you, you can always get reimbursed for that from them in order to give it to them. So now the omnibus final rule, the key provisions. Again, the business associates are now accountable for the same things that the covered entities are. Covered entities are required to modify and redistribute their notice of privacy practices to reflect the changes that have been made. All these things, we sort of touched on these briefly earlier, so it's just another recounting what the key provisions of the final rule were. Then there are the administrative requirements. These are things that you actually will see around you. I mean, these are things that the company has to have, that you'll have to follow, be aware of, be knowledgeable of. Privacy policies and procedures. Privacy personnel, you have to have a privacy officer. Again, any questions that come up at any time when you're working and somebody asks for access to something. If you don't know whether you can give it or not, ask your privacy officer. They're going to know. If they don't know, they can call us and ask us. We'll be able to tell them. It's all in the regs. It's all in the privacy manual. Somebody's going to know. Ask first. Training and education. Again, that's what you're here for today. You're getting training and education on this stuff. Have to be safeguards in place. There have to be a complaint procedure where if someone has a complaint, they can file it. There have to be sanctions for breaches and violations. Again, like I said earlier, you have to have a sanctions policy. You have to follow it. Retaliation and waiver. You can't retaliate against somebody. There has to be mitigation of any violations. Documentation and record retention. All that kind of stuff. This is all the things that the company is responsible for making sure are in place so that you can follow them to ensure that we don't have to worry about these kinds of things in the future. And that then leads us to the security rule. I gave you again a cite to the reg. We're going to just hit the basics today. I'm not going to go into any depth in a lot of this stuff. A lot of this is, again, this is IT's problem. These are things like firewalls, checking the computers, password changes, things like that. I'll at least mention what they are to you. I'm not going to explain a whole lot of them in any depth. We'll give you some of it. But again, just because IT is in charge of it doesn't mean you don't actually have your responsibilities to go along with it as well. The general requirements of the security rule are to ensure the confidentiality, integrity, and availability of all PHI that is electronically created, received, maintained, or transmitted. It has to protect against any reasonably anticipated threats or hazards, protect against any reasonably anticipated uses or disclosures that are not permitted or required, and ensure that you, as the workforce, comply with the security rule. There are 3 types of safeguards that everybody must have in place to help follow through with the, whoops, I'll get that later. Anyway, 3 types of security safeguards. There are administrative, physical, and technical. We're going to talk about all 3 of those here. Administrative are the things like the policies that have to be in place so that the people can follow through with this stuff. Physical are things like locks, keypad access to certain areas, things like that. Technical are things like your firewalls, your computer access things. Safeguards that are listed in the regs consist of standards. These are standards that must be met. They consist of implementation specifications, which are either required or addressable. What that means is the implementation is how you put something in place to meet the standard. Required specifications must be adopted, and addressable must be assessed as to whether they are reasonable and appropriate for the particular entity. You know, HHS knows that not every entity is the same. Some are bigger, some are smaller, have more access to certain things, so they allow them to address these to whether they can use that or something else in place of that. If an entity finds that an addressable specification would not be reasonable and appropriate, then it must document why and adopt an equivalent alternative measure where appropriate. Over 50% of the security rules are administrative in nature. This is because no matter what you have in place, how good your firewall is, how good your policies are, people are always going to be the most vulnerable component of your IT security environment. People make mistakes. People screw up. Sometimes people screw up on purpose. That's your breach stuff, when people come in and steal things or try to get access to stuff they know they're not supposed to have. It's just human nature. There's no way to completely eliminate it. That's why most of the security safeguards are along those lines in order to try and best prevent that from happening. As part of the administrative safeguards, covered entities must implement policies and procedures to provide administrative security. All these are examples of the types of things that must be covered in the policies and procedures. We're going to talk about those individually. First is security management process. This is the key. This is the primary building block in your company's firewall. Your computers have them. We're going to pretend like the company does too here. The primary brick in that wall is the risk analysis. Everybody has to do this. You have to do this repeatedly. The company will address potential risks and vulnerabilities of their entity's electronic PHI. You'll notice that R outside. This is a required standard. Everybody has to do this. It is the basis of any HIPAA compliance program. It should be updated annually or more often. Anytime you bring in new equipment, anytime you make changes to your systems, anytime you make changes to your policies, you should update your risk analysis again. What you do is you identify any potential vulnerabilities and any potential threats. This means everything you can possibly think of. Vulnerabilities are things like, okay, your firewall is in place, but it's potentially vulnerable. You have a certain number of staff that go through these areas. Every staff member is a potential vulnerability. Locks are potential vulnerabilities. Locks can be broken, keypads can be hacked, things like that. Then you have to figure out what your threats are. And they may not be likely, but they're always possible. And you have to make sure that you list every possible threat. This can be theft. This can be things such as forces of nature, hurricanes, tornadoes. We get lots of those around here. Those are always potential threats to your PHI security because they can come in, a tornado hits your building, knocks out your computer system, hits your server, you lose your stuff. Those are threats. So this needs to be done and documented regularly. Following that, you have your risk management, where you adopt sufficient security measures to reduce risks and vulnerabilities. Your sanction policy, again, you have to have proper sanctions for any workforce members who fail to comply. This has to be, again, enforced regularly and throughout. Information system activity review is regularly review records of your information system activity. That's more of an IT deal. But again, the key here is you have to know your risks. You have to be able to assess them. You have to make sure that you know how to prevent them or how to respond to them if they happen anyway. Immediate release, again, here we go. May of 2013, Idaho State University settled a security case for $400,000. OCR's investigation indicated that the ePHI of approximately 17,500 patients was unsecured for at least 10 months due to the disabling of firewall protection at the servers. It indicated that their risk analyses and their assessments of their clinics was incomplete and inadequately identified any potential risks or vulnerabilities. They also failed to assess the likelihood of potential risks occurring again. This is anything you can think of. You have to be creative. When your company's thinking about these, you have to be creative and think of all the possible risks that could come about, all the potential vulnerabilities you have in your system. That's people, technical, all that stuff. These are all risks. The OCR also concluded that the ISU did not have procedures for routine review of their information system in place, which could have detected the firewall breach much sooner had they done so. Another one, this is one of my favorite ones to talk about here because this just gives you an idea of certain kinds of things that you may not think of from time to time. Affinity Health Plan settled potential violations for over 1.2 million because they impermissibly disclosed protected health information of up to 344,579 individuals by returning used photocopiers to leasing agents without erasing the data that was contained on the copier's hard drives. When I first heard about this, it's something I never even thought of, but yeah, pretty much everybody that has copiers now, they have scanners. You know, printers, scanners, copiers, all that stuff. That has a hard drive in it. And anytime you make a copy of any record, it gets scanned and it gets stuck on that hard drive and it stays there. So if you have to get a new copier, new printer, new scanner, things like that, you have to make sure that before you turn it, the old one back in or dispose of it to whatever, that you wipe that hard drive. Everybody's got one of these now. iPhones, cameras everywhere. Don't take pictures of patients. Don't take pictures of records. That gives people more nightmares and more headaches because you don't know what's going to happen to that phone. Phones can get hacked. People can text. People can email. Don't. Please don't give me that headache later. I don't need that. Privacy and security officers don't need that either. Those are things, but that's stuff where PHI can get stored. It can get held there. So don't do that. That's just another thing you have to think about. Something needs to be included in your risks and assessments. Assigned security responsibility, you have to have a security officer. Go to them if you have questions. Again, they're going to be in charge of taking on care of all this. They can always get in touch with us if they need help with that too. Workforce security and information access management. All employees who work with or around electronic PHI must be authorized, cleared, and supervised for appropriate access. Again, not everybody in the company is going to need or be able to access all of the same PHI. If you don't see a particular patient, you don't need to see their stuff. You have to make sure that everybody has certain areas where they stay and that only certain people have access to certain areas until such access is cut off on termination or change in access level. You also need to have policies and procedures which authorize, establish, document, review, and modify their right to access in certain workstations or programs. Security awareness and training. All employees and management should be regularly trained in at least the following: security reminders, protection from malicious software, login monitoring, and password management. You know, if y'all probably get something where you have to change your password every 6 months or every year, something like that, that's part of this. That's a security measure. That's so that only certain people can get access to computers. Security incident procedures. Must know how to identify and respond to, mitigate, and document potential security incidents and their outcomes. You know, I've said a couple times today that, you know, a lot of this is IT's responsibility, but everybody's responsible for this. This one right here is key to remember. If nothing else about the security rule today, think about this. You know what a breach looks like. If somebody that's unauthorized comes in and starts digging around on a computer, or if somebody sends something out they're not supposed to send out, you know that. We're all smart people here. We know what something looks like a breach. You have to know how to identify it, and you have to know how to report it and what to do about it. Basically, the key for you as employees, whether you're IT or whatever, everybody's responsible for this. Don't commit these violations, and if you see them being committed, report them. Those are the two things to remember. Those are the keys for security rule for everybody, above and beyond anything else we talk about. Another part of the security rule is a contingency plan. Company has to have a plan in place for any emergencies, fire, system failure, break-ins, anything like that, any kind of things that damage systems that contain the PHI. You have to have a data backup plan, disaster recovery, emergency mode operation, testing and revision procedure, applications and data criticality analysis. These are all things, again, we talk about, you know, tornadoes. We get the bad weather all the time through here. Something like that hits, you have to have all this stuff in place just in case. Evaluation. The covered entity should perform a periodic technical and non-technical evaluation. So that's where they're looking at all the firewalls and things, but they're also looking at the policies and procedures. They're looking at the people. They look at all that in response to environmental or operational changes which affect the security of the EPHI. BA contracts. You have to have a written contract in place for any BA that you use. That's pretty self-explanatory. Standards for physical safeguards and facility access controls, workstation use, workstation security, device and media controls. Again, making my football analogy. These are the things like the signals from the sideline. You put things in so that you safeguard what you're trying to get out. Just because you're sending PHI out or you're storing PHI out, you have to have certain things in place which protect it, which keep it safe and keep other people from knowing what it is or how to get it. Must make sure that only people who are supposed to be around PHI can get around PHI. In other words, make sure your building's properly secured. There's going to be locks, alarms, key codes, etc. from any unauthorized physical access, theft, or tampering. Validate any employee and visitor access to any facilities where this stuff is stored. You don't want somebody just walking around off the street coming inside where your stuff is stored, getting through your computers, rifling through your file cabinets, any of that kind of stuff. You have to make sure you validate all this. Keep it locked, keep it stored, keep alarms, all that kind of stuff. Workstation use and security. Make sure that your individual workstation is set up and used properly to perform its intended function. Make sure the access to that workstation is restricted to authorized users only. This is something as simple as making sure that you lock the door when no one's in a workstation room. For instance, my office is an absolute disaster area. I have files all over the place, papers running loose. Half the stuff in my office is probably got PHI in it because all I do is healthcare work. So anytime I leave my office, even if it's to go to the bathroom down the hall, I close and lock my door. People can't get in without the key. That's a very simple workstation security standard measure. So if you have PHI laying loose, well, obviously the best way would not be to keep it loose. I should practice what I preach, however I don't. But in case you don't, if you have it laying around, lock it up, hide it, store it somewhere where no one else can get into it. Same thing for computers. If you leave your computer, don't just leave it open. Shut it down for a second, or lock it out so that you have to put your password back in to come back. Things like that. Very simple, very, very effective methods of protecting. Device and media controls. Make sure that the PHI and the hardware or electronic media that it is stored on are disposed of and or reused properly. Again, this gets back to the copy machines, things like that. Anything in your area, your office, your company, whatever, where stuff may be stored, this includes jump drives, laptops, hard drives, copiers, all that stuff. If you're going to if these things get passed around or reused or disposed of, make sure that they're wiped clean first. Make sure that or that you track where they go and who gets it. Like if you're handing out, like if you have a laptop, say the company gives you a laptop. Say you get promoted, you get a new one. Well, your old one, you have to turn it back in, make sure that it's tagged and tracked properly to know who gets it next. Make sure that its access is restricted to whatever level that person may be. Also need to make sure that all data is backed up and stored prior to moving equipment. Say, for instance, you're moving to a new office, and you're going to store all carry all your old copiers and printers and hard drives, all that stuff over. Make sure that that's all properly documented, followed, kept up with. Make sure any movement is taken care of. Standards for the technical safeguards. This is stuff like hardware and software solutions, passwords, encryption, all that kind of stuff. This is more, again, now we're back into the IT area. Access controls, make sure that only authorized personnel are accessing the PHI. Make sure everyone has a unique user ID and password. Automatic log off after preset length of inactivity. Encryption or decryption of electronic PHI. Hardware, software, other procedural mechanisms to record and examine activity. Here's another press release from 2014. 2 entities settled a security case for a combined $1.975 million stolen laptops. If you got a laptop for work, if you keep stuff on it, don't just leave it in your car. Do not. My niece taught me a saying maybe 4 or 5 years ago when she was like 5 or 6 years old. I think it's great. Stow it. Don't show it. If you're going to leave your car, don't have the laptop sitting up on a seat. Hide it under the seat. Take it with you. Do whatever. Don't leave it in there where somebody can just walk by and steal it. Of course, the best way, again, would be to not have it in there. But if you do, hide it, lock it up, do whatever. Make sure you have passwords on it, all that kind of stuff. Take every precaution possible to keep it from getting in the wrong hands. This was 1 laptop each. So it's not even that it has to be a whole lot of stuff. Now, I feel like this happens to me every year. As soon as I get these slides made and sent in, something new breaks and happens that I could have had in here but don't. Just this week on Monday, Centene Corporation, again, I'll talk about this one, has 1 laptop each. Centene Corp, I don't know if anybody heard about this week, did they? Anybody? They're a health insurer, and on Monday they announced publicly that they have just lost 6 hard drives. Just lost them, don't know where they are. that contain approximately 950,000 individuals' protected health information. Now again, nothing's happened yet. We don't know that they've been stolen. We don't know what. But the key is there's a potential. There is a potential that these things could be used in violation of any security. So therefore, they are required to report, and they're more than likely going to get hit with a penalty at some point for this. They said in their notice that they put out that they don't think they're using it appropriately, but they're reporting the search out of an abundance of caution and transparency. Those are great words. Those are great things to say. They're also required to do this too. You got to let them know anytime you have a potential breach, you have to notify. Here's another one. UCLA Health Systems Facilities had a settlement for about $865,000. This is another fun one. 2 security complaints were filed with the OCR on behalf of 2 celebrity patients at the hospital who received care there, alleging that employees repeatedly and without permissible reason looked at their EPHI. OCR investigated and revealed that from 2005 to 2008, unauthorized employees repeatedly looked at the EPHI of numerous other UCLA patients. Some names implicated include Tom Cruise, Britney Spears, and Farrah Fawcett. You get a famous patient, if you ain't seeing them, if you're not working with them, don't go look at their stuff. If you're not allowed, if you're not part of their care, don't go look at their stuff. Don't go look at your boss's stuff. Don't go look at anybody's. This is what we're talking about again, about how individual people have different access to different individual stuff. If it's not in your area, don't go looking, because now you're going to get penalized and the company's going to get penalized. And I can promise you, TMZ is not going to pay you enough to cover the fine. Integrity and transmission security, you have to have policies and procedures and technical security measures to authenticate and protect any electronically transmitted PHI from improper alteration and destruction. A lot of times, and we always recommend don't do this if you don't have encryption, but a lot of times people will email or fax medical records. If it's a page or 2, they want to send it fast, they'll fax it over, email it over. The best way to do this is encryption. If you have an encryption system in there, you always want to encrypt your data before you send it. Not everybody has that. Sometimes it's cost prohibitive. Sometimes you don't do it enough to really justify being able to use it. Again, we recommend not doing it, but I've got to admit, I email stuff all the time too. But what you do is you make sure you have policies and procedures in place and other technical stuff in there to make sure that where you're sending it is the proper place, that who you send it to is correct, that how you send it is correct, and you always ask for a receipt or whatever. These are steps you can take to make sure that the proper person gets the information. Another immediate release, Phoenix Cardiac Surgery had to settle for a lack of HIPAA safeguards. They ended up having to pay about $100,000. They were posting clinical and surgical appointments for their patients on an internet-based calendar that was publicly accessible, but they had implemented very few policies and procedures to comply with the privacy and security rules and had limited safeguards in place to protect the EPHI that was being put out there. Sort of the key to this one is that size doesn't matter. This was a 5 physician groups, all it was. They still got popped. So big, small, whatever, you need to make sure that you understand what these requirements are and that your folks meet them. CHS, everybody knows community health systems are. This was from last year, or August 2014. They reported a data breach resulting from a foreign-based cyber attack. I can't remember if this was some of the folks from Russia or where it was, but they had a foreign-based cyber attack of their computer network in April and June of 2014 that exposed HIPAA-protected data of over 4.5 million patients in 29 different states. There have been at least 2 class action lawsuits filed against CHS as a result. And according to an estimated calculation by Forbes, the data breach could cost them anywhere between $75 and $150 million for all this. That includes both the class action stuff and the penalties they're going to have to pay to HHS. I have looked, and I have not seen that there's been any actual official finalization of this. I think it's still in the hopper, but by all accounts, it's going to be a pretty big number. So again, these are the kind of scare you straight stories you get. Make sure your stuff's protected. That will get us to what actual breaches are and what you have to do if a breach occurs. Breach notification requirements. These are new under high tech. What is a breach? Is any unauthorized acquisition, access, use, or disclosure of PHI which compromises the security or privacy of such information, except where an unauthorized person to whom it's disclosed would not reasonably have been able to retain it. Under the omnibus rule, definition was revised. Now, any impermissible PHI use or disclosure is automatically presumed to be a breach. This means that breaches will now be more common than they used to be. All situations except those in which there's a low probability that it's been compromised or one of another specified statutory exceptions applies will be considered a breach. They have also removed the harm standard. You don't have to assess whether or not harm has actually occurred or will actually occur. You just have to assess the probability of whether the PHI has been compromised. The exceptions to a breach presumption are any unintentional access by a workforce member. So if you see something on accident, no big deal. You're acting under authority of your boss. It's made in good faith. There's no further use or disclosure beyond you. Those are fine. Any inadvertent disclosure among authorized people. If both sides are authorized to access it and they talk about it, that's okay. If there's an inability to retain it, for instance, say you have a janitor who comes in your office and they sweep and they vacuum, do whatever. They see a sheet of paper on your desk. They don't take it with them. That's not a breach. Any low probability of compromise based on the risk assessment that your company has done. So what is unsecured PHI? Any PHI that's not either encrypted or destroyed. So basically anything that's a hard copy, anything that's on the computer that you haven't encrypted before you send it, that's unsecured. These methods are not required if you use other methods that are allowed, but they're the only methods which provide relief from having to notify everyone if a breach occurs. However, if you do have encryption and your encryption key is improperly disclosed along with the document so that someone can put the two together and figure out what it is, then you also have a breach there too. Breach versus non-breach is compromised if it poses a significant risk of financial, reputational, or other harm to an individual. Anybody gets out a social security number, that's always bad. If that's included in the PHI that gets used or disclosed, that's always going to be a fairly high, significant risk of financial harm. Say you have a patient that has HIV or AIDS or some other kind of thing that's generally people, whether rightly or not, have a prejudice against. That kind of stuff can cause reputational harm, that type stuff. HHS directs covered entities and BAs to perform a risk assessment once a breach is discovered to determine if there is a significant risk of harm to the individual as well as a result of the impermissible use or disclosure. Again, that significant risk of harm is not what requires you to notify anymore, but you still have to do it. The risk assessment has now been modified to consider at a minimum the nature and extent of the PHI involved, including the likelihood of re-identification, who the unauthorized persons were who used or received it, whether it was acquired or viewed, and the extent to which compromise has been mitigated by the company. These are the breach notification requirements. I'm not going to read all these out. They're pretty self-explanatory again, but basically this is what you have to do. You have to send it out via written notification, how you send it. There are some differences on how, there are differences in, say, if 5 people's PHI is compromised versus if 500 people's are. You can look at those there on the slide. These are what have to be included in the notification. I'm going to breeze right through those two. You can read those. They're fairly self-explanatory as well. BA notice. This is where you have to worry about if the breach occurs at your BA level rather than at your level. BAs are required to provide notice of the breach to the covered entity, not to the actual individuals. If the BA is acting as an agent of the covered entity, then their discovery will be imputed to the covered entity. So what that means is if they're acting as your agent rather than as an independent contractor or however, once they discover it, generally you have 60 days to notify the individuals of the breach. Normally with a BA, if they're an independent contractor, you have 60 days from the date that they notify you that they found out. If they're acting as an agent, you have 60 days from the date that they actually find out whether they notify you or not. They're required to notify you, but just because they don't doesn't mean you're not still on the hook. A covered entity is also subject to sanctions if it has knowledge of a pattern or practice of the BA that would constitute a material breach or violation of its BA agreement, and subsequently fails to take action to cure that breach. So you need to make sure that you know that you need to make sure as a company that the BAs are aware of their reporting responsibilities to you. And you need to be aware of what they're doing as well. This again is about the agent and the independent contractor. I just sort of went over that. Breach statistics. I have not had a chance to update these. I haven't actually seen any updated since August of 2014, but as of then, the most common cause of reported breaches was theft, more than half. The next leading cause was unauthorized user disclosure. The most common location, again, coming back to laptops, 22%. Next most common was paper records. And the number of complaints to OCR have increased from 2011 to 2013, and the number of investigations have increased as well, which makes sense. Adult and pediatric dermatology of Concord, Mass. agreed to settle for $150,000. This was the first settlement with a covered entity for not having policies and procedures and training their workforce members on the same to address the breach notification provisions. Not even so much that a breach happened, just that they didn't have the policies and procedures in place in case it did. They also, again, we get back to the risk analysis. They failed to conduct an accurate and thorough analysis of their potential risks and vulnerabilities as part of their security management process. So they sort of hit them from both ends here, security and breach notification. Now we get to the reason that all this really matters, how much it's going to cost you in case you screw up. C&P amounts. The High-Tech Act, when it came out in 2009, established 4 categories of violations that reflect increasing levels of culpability and 4 corresponding tiers of penalty amounts. Now, previously, before High-Tech, HHS could not impose a penalty of more than $100 per violation, up to $25,000 during a calendar year for all identical violations of the same provision. And a covered entity back then could bar any penalties by showing that it did not know or did not reasonably know that it violated HIPAA. That has all changed. Under High-Tech, and I guess I'll go through the 4 categories as well. The 4 categories, Tier 1 is that you did not know. Tier 2 is that there was a reasonable cause for why the breach happened. Tier 3 is willful neglect that has been corrected within 30 days. And Tier 4 is willful neglect that has not been corrected timely within 30 days. Now, under High-Tech, the maximum penalty is $1.5 million during a calendar year for violations of an identical provision. What they'll do is, for Tier 1 violations, each individual can go anywhere from $100 to $50,000 with a maximum of $1.5 million. Tier 2 would be $1,000 to $50,000. Tier 3 is $10,000 to $50,000. And Tier 4, for the willful neglect that has not been corrected, every individual instance will be $50,000 up to a max of $1.5 million for multiple violations in a year. And the covered entity now can no longer bar a C&P just because it didn't know. It has to correct it within 30 days first. It can still get that if it corrects, but it has to know and correct. HHS imposed a $4.3 million civil money penalty for a privacy rule violation on Signet Health back in 2011. And I mentioned this one a little earlier, we're coming back to it now. Or I mentioned what they did here. They denied 41 patients access to their medical records when they were requested. Again, if a patient requests access under the privacy rule, you have to give it. You have up to 30 days to provide the access, but you have to give it. They denied it. They wouldn't do it. So they got popped for that for $1.3 million. They also refused to respond to HHS's demands to produce the records once the complaint was made. They got popped another $3 million for that. So again, the key is do not tick off the HHS. If you mess with them, they will mess back and they carry a bigger stick. The omnibus rule also confirmed the tiered C&Ps. This is the 4 categories. It confirmed the maximum amount. It also revised the definition of reasonable cause, which is your second tier. This is now circumstances that would make it unreasonable to comply despite ordinary business care and prudence, and circumstances where you have knowledge of the violation but you lacked a conscious intent or any reckless indifference, which would be associated with tiers 3 and 4, which are the willful neglect. HHS will look at certain factors in determining how much C&P they're going to apply. That includes the nature of the violation, the nature and extent of any resulting harm, your history of prior HIPAA noncompliance, and your company's financial condition. The nature of the violation now will include the number of individuals who are affected, so the more people whose stuff goes out, the worse it's going to be. Think back to what we talked about earlier about Syntec, where they have 6 hard drives with 950,000 people. If they get popped, they're probably going to get popped pretty hard. Nature and extent is also reputational harm, like I talked about earlier. and prior compliance now has broadened the Secretary's view to permit consideration of previous indications of noncompliance rather than solely previous violations. So just because you haven't been popped in the past doesn't necessarily mean you don't also still have a history of some compliance issues. The omnibus rule also confirmed the willful neglect standard. Basically what this does, if anything in their preliminary review indicates that there's a possible willful neglect, they are required to investigate. If it does not indicate willful neglect, they have the discretion. There are criminal penalties for HIPAA now. The DOJ enforces these, that's the Department of Justice. Can include conviction of a criminal offense under HIPAA, can be a fine of up to $50,000 plus up to 1 year in prison. If the violation was committed under false pretenses, so if somebody comes in and pretends they're somebody else to get information, that goes up to $100,000 in 5 years. And if they broke the law for their own personal gain or malicious reason, it goes up to $250,000 in 10 years. April 2010, Mr. Zhu here was a former employee at UCLA Healthcare System Hospital again. He got 4 months in federal prison, a $2,000 fine, and a $100 special assessment for accessing the hospital's electronic health record system without authorization. Basically what happened is in 2003, he was given his notice, he basically given his 2 weeks notice of intent to dismiss. Or it may not have been 2, it may have been a month, I guess. They were going to dismiss him for job performance related reasons, which were unrelated to his illegal access of any medical records. He hadn't done it as of yet, but he got his notice, he got his walking papers, stuck around the hospital for 3 more weeks, and during that 3 weeks, accessed at least 323 patient records that he did not have authorization to do, including his immediate supervisor and Arnold Schwarzenegger and Tom Hanks. There's no evidence that he improperly used or attempted to sell any of this information. All he did was access it, and for that, he got a fine, jail time, and another assessment. So again, this gets back to, if you don't have authorization to look at this stuff, don't do it. The company will get popped, you will get popped. But you have to at least take the steps, you know, the baseline level steps in order to prevent any of this stuff from happening. Criminal penalties, a little bit more on this. Per 2005, the OIG, which is the Office of Inspector General, issued a memo that a provider's management may be liable for the employee's criminal actions under general principles of corporate liability. I'm sure that'll make your bosses always happy. In the same memo, the OIG stated that HIPAA criminal liability was limited to covered entities only. High Tech has since expanded that to include BAs as well. And by allowing criminal penalties for wrongful disclosure to apply to individuals who obtain or disclose PHI maintained by a covered entity, whether or not they are employees. So if anybody comes in, they get criminal penalties. Lastly, not lastly, I've got maybe 2 left. Omnibus rule clarifies the affirmative defenses. If a criminal penalty has been imposed, Secretary may not also impose civil money penalties for the same act. For violations that occurred prior to 2009, we probably shouldn't have any more of those at this point. Secretary cannot impose a CMP for reasonable cause. Now they can for the reasonable cause unless you correct it within 30 days. And that's this last one, that the affirmative defense is if it was not due to willful neglect and was corrected. Lastly, the Attorney Generals in the states now also have authority to prosecute for HIPAA violations. They do it on behalf of the states. It's still not really an individual cause of action. So say if your personal information at the hospital, say we get calls about this all the time in my office, people call and say, well, I was at the hospital and this nurse who knows my husband and doesn't like me got my stuff and called and told him I had this and this or whatever. You cannot personally sue. The Attorney General can sue on behalf of the state. That's sort of how this works. Remedies include injunctive relief and or damages in the amount of $100 per violation, up to $25,000 for a calendar year. The court may also award attorney's fees to the state if it prevails, and the Department of Health and Human Services may intervene in these actions if they deem fit. A couple of these have been filed. I know Connecticut was the first state that did this. There have been a couple more since, but these really aren't very widespread yet. But that's just something else that's out there. And that's all I have today. I know everybody's probably hungry, so I won't bore you anymore. Any questions? If not, thank you all for staying awake for me. I appreciate it. Y'all have a good day.